and welcome to yet another special session on cancer care during COVID-19. I am Kamal Narayan, CEO of ISW Council, India's premier institution for health advocacy, awareness, and behavior change. With this show, we have been trying to bring authentic and useful information for effective cancer care from the country's top experts during this ongoing pandemic. This is because people living and battling with cancer need extra care and attention due to their lowered immunity and special psychological needs. Our today's session is about thyroid cancer. Yes, that tiny butterfly shaped gland can also become the breeding ground of a disease as serious as cancer. However, it is not very often that we hear about thyroid cancers, but it's equally critical to be aware about this disease. And to discuss thyroid cancer with us, we have Professor Dr. Chandrasekhar Bal from All India Institute of Medical Sciences. Dr. Bal is the head of Department of Nuclear Medicine at AIIMS, New Delhi, and he's among the most authoritative voices in the field of medicine and has often reviewed the lack of infrastructure in India to handle rarer forms of cancers such as thyroid cancer. So welcome Dr. Bal on this special show today. However, before I begin our conversation, I would request our online viewers to keep sending their questions on the comment box, and we will try to answer most of them in the next 30-40 minutes. Also, like, comment with your feedback, and do share this special show on your wall to help many others who may get benefited from this information. So let me begin the conversation with our very special guest today, Dr. C.S. Bal. So, Dr. Bal, let me begin this conversation by asking a basic, question that what is the role of thyroid gland in human health? And then we go that how cancer impacts it and how it can, lead to something which includes, unhealthy or suffering outcome.
Yeah, thyroid is one of the largest endocrine gland. Endocrine glands are essential for our body because they control our humoral system, and nervous system is our electrical headquarters. So there is integration between the electrical and chemical system in the hypothalamus, and the highest endocrine gland is pituitary gland. And between pituitary and hypothalamus, there is a duct through which they communicate. And hypothalamus integrates all the information from humoral and chemical, humoral and electrical. So that's why even though head to toe, we have all the glands, there is these endocrine glands are special glands because they secrete hormones. And those hormones control the whole body function. And there are many hormones which are in different part of our life. During intrauterine life, we have different hormone like chorionic gonadotropin hormone is essential for the development of placenta. But there are some hormones, particularly there are three major hormones which are thyroid hormone, insulin, and the steroid hormone. They are they come with us and go with us. So they are from the beginning to end. So they are called metabolic hormone. In the intrauterine life, thyroid hormone helps in the development of the brain, the nerve system. So imagine now the hormone helps the development of the electrical system. And the thyroid, absence of thyroid will not make you idiot. Is not a sort of scandal, but you idiot means when your IQ is below certain number. So less than 40, you say idiot. And then below that, it will imbecile, like that. We have got different terminology used for describing the intelligent quotient. So the after the birth means up to the first year, 1 year or 2 years of your life, still the brain start developing till 2 years, and there is some sort of modification occurs up to the 8th year, and after 8th year there is only connectivity. There is no neuronal further development. So this period, thyroid hormone has to be there to keep the brain normal developing. And the rest of the life, it controls the metabolism in the sense, whatever we eat, 80% of them is used for production of energy. And the energy production is controlled by thyroid hormone. So so it is a very, very important gland. Why it is not, as you told, why there is not much of discussion about thyroid gland, because thyroid gland, the death due to thyroid gland is much less compared to the diabetes, compared to the adrenals, compared to the testicular tumor or ovarian cancer, and all these are very, very fatal cancer. But among all the endocrine gland, among all the endocrine cancers, 90% occurs in thyroid, but they are good cancers. They are good cancers. And interestingly, for last 30 years, the highest number of cancer growing in any organ in the body is the thyroid in the world now. From 1% of the total thyroid cancer, it has now increased to 3 to 4%. In some population, it is up to 10% of the population. And there is a prediction by 2030, year 2030, the thyroid cancer will be number 2 among the women and number 3 among the men.
So right now we have cervical cancer, breast cancer as the number 1, number 2 cancers among women.
Depending on the world, no, in Indian or in the developing country, in the underdeveloped world, cervical cancer is more common. But in the developed world, because of the hygienic condition, there is much less. The number 1 is breast, number 2 is ovary in female.
So in that scenario, thyroid cancer is going to become number 2 cancer.
Number 2, it will exceed the ovary and exceed only it will be next to breast cancer.
That definitely calls for much more awareness about it, I think. Yeah.
So that's why thyroid gland is the largest endocrine gland in the body. And being the largest, it also suffers a lot. So there are three different types of disease thyroid gland suffers. One is because of hypofunction. In the body, we have got more, in the world also, more non-functional people are present than the functional people.
Okay.
So that's also thyroid. So non-functioning idle thyroid gland is much more common, 10 times more common than hyperfunctioning thyroid gland. And then 1/10 of the hyperfunctioning is thyroid cancer. So the ratio is like 15% is hypothyroid and 1% is hyperthyroid and 0.1% is thyroid cancer in percentage terms.
So thyroid cancer happens in the condition of hyperthyroid.
No, it is more common in hypothyroid condition.
Okay.
So the thyroid cancer per se is a genetic disease. It has got both somatic mutation. It is related to BRAF, TOT, and many other RAS, and there are 2 different types of. We are not going to talk about those because they are a molecular aspect. So I'm not.
Yeah. So we want to keep it simple. Yeah.
Simple. So this is a cancer which is de novo, arises in the gland, and because thyroid has got differentiated cells, even this is cancer, but it maintains its normal function. So that means it produces hormone. It takes up iodine and produces hormone. That's why thyroid cancer is the first one in 1942 was treated with radioactive iodine. What is radioactive iodine? Normal iodine is 127 atomic mass. If you make it more neutron, you put inside the atom becomes unstable. And that is I-131, which is radioactive. But body cannot recognize whether it is a normal iodine or radioactive iodine. So because iodine is the raw material for thyroid hormone synthesis, the body will take off, the thyroid gland will take off the iodine and will be taking, in fact, it is taking a radioactive iodine, it's taking a poison without knowing. And then in the cell, the I-123, I-131 will decay and produce a small tiny bomb inside the cell and the cell will die. This is very, very specific, limited selective uptake of the tumor by the cell, and for it's like a suicidal mission. It's targeted therapy.
So how does this radioactive iodine goes in our body?
We have you see, for the any raw material, it has to be for hormone synthesis. We need raw material. The raw materials are amino acids, and then we need the iodine. And thyroxine is a 4 amino acid which has got 4 iodine atom attached to it, and thyroxine. So that is why it is called tetraiodothyronine. And if you take out one iodine, it becomes T3, which is the final hormone. And that has got 3 iodines. So the iodine per molecule, 4 iodine necessary for thyroid hormone synthesis. So iodine is facilitated, entered into the cell by the cell membrane, in the thyroid cell membrane, and that is even it will be against the concentration gradient. So the cell spends some energy to push the iodine from the circulation inside the cell, and these iodines inside the cell are used for hormone synthesis. So we have a special mechanism called thyroid iodide importer.
So like just to understand, Dr. Bal, in a maybe more simpler way, like we take iodized salts.
Yes.
And iodine is very important because it helps in your let's say thyroid gland's health, and it is important for it to kind of function properly, or absence of it can lead to certain diseases. Now I want to understand, or maybe it may be useful for the viewers also, that when we are taking this iodized salt, we are taking iodine, but how do we take this radioactive iodine, which our body don't know that it is harmful, and how does it go?
Iodine has got a unique property. Iodine has got a unique property in our body. Iodine is lipophilic, means it is soluble to our skin. Skin cannot stop. If it is fall on the skin also, it enters into our circulation. Okay. So there is no need of giving injection. You can give orally, and 100% will be absorbed into your circulation.
Okay.
Because for like ghost, you can see the walls cannot stop the ghost to come in. So the iodine can just walk into the body, and then there is 100% absorption. That's why iodine is given orally always. And even if you do with your iodex balm or painting with any iodine containing thing, that get absorbed into the body.
Okay. So this radioactive iodine which goes into the cell of thyroid gland, it creates the cancer.
No, this cancer cell is killed by the iodine.
Okay.
So the iodine, which is normal iodine, we are replacing this normal iodine with radioactive iodine.
Okay.
Now the cell will not recognize whether it is normal iodine or radioactive iodine. It will take the radioactive iodine and will get killed.
Okay.
So there is a targeted therapy.
So this is a targeted therapy for that.
Yes, exactly. This is discovered in 1942. Okay. Imagine now in oncology we talk of precision oncology, we talk individualized therapy, we talk of target therapy, and we are practicing radioactive iodine therapy since 1942.
80 years.
No. 80 years of history and 80 years of experience.
Okay, so might be the present day targeted therapy has taken cue
from to emulate what is happening in case of iodine. Iodine is like a model. Iodine treatment in thyroid cancer is a model, and all other cancer are trying how to we can reach the same level of precision.
Utilize the same model, yes.
Same model and same precision.
Dr. Bal, now to so that's important. So we got to know about that, how the thyroid cancer treatment has been there, and very targeted treatment is being practiced for 80 years now. But to kind of for the help of our viewers, what are the thyroid cancers? How does it happen?
Exactly, thyroid cancers are classified into the cancers arising from the thyroid cells. And these thyroid cancer cells are differentiated, and differences in the sense when this cancer cell look like the normal thyroid gland, it is called differentiated. When it slightly look away, not like the parent, not like the normal thyroid cell, but it is looking like slightly different, we say it is poorly differentiated. When there is no relation, it is arising from the thyroid but has nothing to relation, like a white parent having a black child. You say, yes, no, this cannot be their parent, that is somebody else. Similarly, when the cells are totally different, there is no similarity with the parent cells, so they are called anaplastic. There is no relationship to the parents. So the thyroid, in one hand, left hand side, we have very differentiated, just like normal looking like thyroid cell, and but they are cancer. In other side, there is no relation to the parent, but they are very aggressive. And the paradox is that thyroid cancer has one side completely curable cancer in one side, the other side most deadly cancer known to human being. That is anaplastic thyroid cancer. In the same tiny gland, we have a cancer where with this cancer you can survive whole life, normal, get married, having children, normal life. In another, you have got few weeks to months life total. Nobody survive more than 1 year in 99% of the time.
So that is the good cancer which you said.
I am talking 99% of the 98% of the thyroid cancer are good cancer.
Yes. Okay.
Only 1 or 2% is bad cancer. So that's why people don't talk about the thyroid cancer. 99% is good cancer.
But bad are the worst type. Means that's the
if it is bad, really bad. If they are bad, really bad.
Okay. That's interesting. So in India, what kind of type?
In India, because earlier 40 years back when I started my thyroid cancer practice, we used to see a lot of follicular thyroid cancer. Follicular thyroid cancer occurs when there is iodine deficiency in the environment. The soil contains iodine, and as you go from south to north, the food habit changes. In south, everybody eats seafood, means fish and everything. But as you go up and up and up, there will be less amount of seafood. What happens when from the Gangetic belt in the sub-Himalayan Tarai region, all the glacier snow, they take the iodine out from the soil, and it goes to the river, and then goes to the sea. So that is why the sea is the richest source of iodine. The soil, if there is iodine in the soil, the plant will grow better, the cows will give better milk, the calves will be better. So that's why it was not only human being, all the livestock will be also affected by iodine deficiency. So the milk production in the iodine deficient environment with the cows and buffaloes will be much less compared to the normal healthy counterparts. So that's why the iodized salt was introduced way back in 1980s and 85, the Universal Salt Iodination Program. And now, luckily, all part of our country has got iodine sufficiency. Yes. Except Kerala, other part of India, you cannot even sell normal salt. You have to say fortified salt.
But in Kerala, you can sell non.
Because they eat all the seafood. They don't need any salt. There is iodine content in their normal food is very high. But paradox to them, they have got a lot of monazite salt on their soil. So there is thyroid cancer in Kerala is high. Because the radioactive sand is much more along the seashores, you can see. That is why all these rare earth collections and everything is in Kerala, in Odisha, Gopalpur beach, and all these beach contain the soil, sand contain the radioactive monazite salts.
Okay.
So one side they have got plenty of iodine, other side their salt is not good. Their soil is not good.
Okay. And so despite that there is enough iodine coming, that it's still making a different kind of challenge. So as I was asking Dr. Bal, so in India, what kind of cancer we see more, like 98%?
Yes. Now, that is what with the last 30 years, the picture has changed. Earlier, we used to see 50% are called papillary thyroid cancer. Why it is called papillary? Because it's like a finger-like projection. It is called papilla. In medical term, and in medical term, we have a lot of things called papilla, and finger-like projections. Okay. That is the commonest in 50% in earlier, in 80s. And 50% used to be follicular, because follicular thyroid cancer occurs in the iodine and deficient environment. As the universal iodination reached the saturation point, normalization of this iodine level, now we are seeing 80% is papillary, 10 to 15% is follicular, 5% Hürthle cell carcinoma, and another 5% is poorly differentiated thyroid carcinoma, and 3%, 2 to 3% medullary thyroid carcinoma, and 1% is anaplastic. Earlier, anaplastic was 5 to 10%. Now, because of the iodine environment has improved, so the anaplastic thyroid carcinoma has also gone down to 1% only.
So that the most dangerous type of cancer
is gone
has
down to 1%. And little worse than that is the medullary thyroid carcinoma, which is another 3 to 5%. And poorly differentiated thyroid carcinoma, another 10%. So 10 altogether, 90% thyroid cancer in this country, in our country, is much better compared to 10%, which is bad to worse.
Okay, so there are 10% which are at the severe
other end of the extreme end.
Dr. Bal, like we know some of the numbers, like India has around 11 to 12 lakh of cancer cases being reported every year. We know that in breast cancer we have around 1,80,000 cancer cases are reported, and out of that around 90,000 or 87,000 to be precise people die, or women die. Out of that, 50% of do we have some kind of absolute numbers for thyroid cancer?
If you compare the Indian cancer statistics, Indian cancer statistics based on few urban and rural registry, you know that, very limited. It only 7% of the population data has been entered into the registry, and from the 7% you are extrapolating to 100%. In US this year, that is the database, which is very popular, and all the data recorded from this year is now every year published in that, which constitute almost 38% of the population. Covers 38% of their population. They are taking 38% extrapolating to 100, and we are taking 7% and extrapolating to 100%. So naturally, our data will be not that robust, and then compared to the US data. Second, the incidence of the thyroid cancer in our country is less compared to America. Do you think our healthcare system and our environment is much better than what Americans are? No. The reason is the demographic profile. If you are not dying in the first year of your life, unlikely you will die in next 10 years.
Okay.
Like toddlers, they entering into the wrong place, falling, accident, and their possibility. Between 10 years to 40 years, you will be only, most of the time you will be dying of accident and other things. Between 40 to 60 years, if you are going to die, chances of dying because of the heart disease is much more common than anything else. If you survive your retirement, say 60 years, and without any heart disease, and your heart is healthy, you have no diabetes, you have no hypertension, then chances of dying of cancer is very high. That means older people will have chance of dying cancer much more compared to the younger people. You know what is the average age of India?
Around 67 or so.
Average age, not life expectancy. I'm talking average age.
You have to enlighten me.
Yes, the average age we calculate every person in this country. So how many children, how many adults, how many, how many 100 years in our country, the number of people, centurions are less than 0.1%. You know what is the number of centurions in Japan? 11%. 11% people are more than 100 years.
11% people live more than 100 years.
Yes, in Japan. In India, we have less than 0.1%.
While we had that, whole concept of living 100 years has been a Satayu is something I think the very integral part of our, whole Vedic culture and all that.
Yes. That will be happening, but that will happen another 10, 20, 30 years it will take, because now the average age of India means all the people surviving in this geographical landmark that is called India. If you take their age, divide by the number of people, 140 crore, that will give you the average age. And the average age of India is 25 years.
25 years.
Average age of India is only 25 years. Because why? Because the graph is like this.
So then can you tell us what is the averages of, in that sense, of, some other countries, just to compare us?
Some are, so in Japan, it is already 60 years. In US, it is 63 years. In Italy, why so many people died in Italy? Because Italy has more older people than younger people. Scandinavian countries are closing their pediatric hospitals and getting it converted to geriatric hospitals. What is the population dynamics? If you, husband and wife, produce 2 babies, your population is stable. If you produce more than two, then population is growing. If you produce less than 2, your population will sink. You know what is the population dynamics in Scandinavian countries? It is only 1.2. Means another 50 years time, everybody will be old, and there will be hardly anybody to look after them.
No younger
Because
people.
if 2 people will produce 1, that means it is reduced by 50%.
Yeah. So, sir, you said that if you cross 60, then your chances of dying with cancer are very high.
Yes, that
or
is
your,
why
your chances
as
of
the
dying.
population will go on increasing, the incidence of cancer will also go on exponentially growing.
But I have a doubt or a question that, as you are saying that if you have a healthy heart and you have no diabetes, you don't have any other morbidities or some other health problems, and you cross 60, I think then you are having a healthy body, you have maintained a healthy body.
Yes.
Then why, then I think
why you develop cancer? Yes.
Cancer should also be prevented with that.
Yes. Why you are developing cancer? The reason is that every minute we develop cancer cells. Every minute.
Always.
We have got every minute, because we are eating a contaminated food, we are exposed to sunlight, we are exposed to cosmic radiation. When we are doing transatlantic flight or we are doing aeroplane travel, we get radiation.
Okay.
So if you are taking drugs, you are taking chemicals, you are taking adulterated food, all are going and producing change in your...
Or you are breathing in Delhi air.
Yes, Delhi air also. Yes. That will be... Or cigarette smoking and alcoholism, all these add. We have every second in our body, there is change in the genes called mutation. Some mutations which are lethal, the cell take care of that. They will die, just like miscarriage. Why occurs in some ladies there will be more miscarriage? Because the child, if it's genetically defective, nature throws it out. So the miscarriage, similarly equivalent, is your cell get killed, called lethal mutation. If there is a lethal mutation, cell will kill they will not further progress. But there is a small change, and in our genetic code consists of 4 letters, A, T, and GC, and these 4 letters write all the genetic codes. If you change only A, if in place of A you put U, in place of A you make it T, or you make G into C, there will be different amino acid and different protein. And this is all the time continuously. Even if you have got 5 siblings, all 5, they don't look same, totally different. How? Same parents, we have same genes. How come the 5 people are different? The reason is that there is continuous process of evolution, continuous process of gene change in our body. But most of the genes are good, but very few are bad. What happens with the time? These genes go on increasing in the number. After certain critical time, they're called oncogenes, which are cancerogenic genes. They become more dominant and they produce cancers.
That means it's part of our gene evolution, and which is a mutation also, we can say.
You have to pay the price. You have to pay the price. Imagine if all the genes would have been same, all the human being would have been like penguin. Can you recognize any penguin? This one is Ramlal, this one is Samlal. You cannot. All they look same. Imagine go to a school where all the kids look same. You will look for your kid. You will be asking it, howling, who is my kid? Please come, because you will not able to recognize.
Okay.
So the genetic code, using only 4 alphabets, continuously change. All the siblings are different. Even if they have taken the same parental gene and they are all composition are same, but there are 5 different people.
And not only for all siblings, for I think every human being in this world,
yes,
present, past, future, they all will have a unique code.
Yes, because imagine only 4 alphabets they are using.
So out of those, that's very interesting. That's the
And
wonder
these
of this.
alphabets also, you know, when you have to, for this, everything you have to pay price. Whether you want to be a good doctor, you have to pay price. If you want to be a good husband, you have to pay price. You have to be a good father, you have to pay price. You have to be a good son, you have to pay price. So every time,
Good
so
gene also you have to pay price.
so the cancer is the price you are paying, because you are not, two are not different, two are not same. So cancer is a byproduct of this evolution. It's not a disease. It's not like virus goes and eats out your lungs and you become dying of COVID. It's not like that.
But this byproduct is caused because multiple factors, which
Yes, other
are
than the.
contaminated factors, for example,
Yes.
which so, you know, I think maybe what we see, that the number of cancer cases are increasing, which were not you know, that much in the past.
Yes.
So that means the earlier those evolution was not causing any kind of bad gene.
So there are few things which are very proven has got oncogenic or carcinogenic. There are like smoke, your cigarette smoking, your tobacco chewing, which is, that is why in India we have got very high population of head and neck cancer. Compared to the West, we have got very high tongue cancer, oral cancer, mouth cancer, head and neck cancer is much more because of tobacco chewing and use of tobacco in form of pan, gutka, cigarette, tamaku, putting the in the gum, some very things in the, they do like this, and khaini or something like that. And all this is carcinogenic, proven. Number two proven cause is the chemicals. That chemicals which are adulterated in the oil, the chemicals that is adulterated in your food, the chemicals adulterated in the processing of the food, all your preservatives, all are chemicals. These chemicals have got a tendency to damage the DNA. Number three, ultraviolet light. Why the people are now very much more concerned about the ozone break? Because the ozone is the one which prevents the ultraviolet light coming into the atmosphere. And if there will be ozone holes, the sun's ultraviolet light will go directly affect the DNA, which is get stimulated at the 290 to 300 nanometer ultraviolet range. So that's ultraviolet range. Third, radiation is known to cause cancer. If you are exposed to radiation, that is why I told you transatlantic flights, cosmic radiations, your environment, like earlier the watches are painted with radium dials used to shine in the night. And those people who are painting that, they developed all cancer. So then radiation is known proven cancer. And somebody you are undergoing again and again chest X-ray, CT scan, this scan, that scan, will get all radiation. So that is an again proven cancer. So all this, and even if all, in spite of all this, the aging per se and obesity. Aging and obesity and other two factors. And third, and very less number is virus. What are those viruses which produce cancer? Those viruses are like your Burkitt's lymphoma is by the AB virus, Epstein-Barr virus. We have got carcinoma cervix is a papilloma virus. That is why people are now. Similarly, herpes simplex B virus, then HTLV virus. There are 7 or 8 viruses which are known to produce cancer. Remaining viruses are not. Only one bacteria produces cancer, that is your peptic ulcer bacteria, that is H. pylori. No other bacteria produces cancer except H. pylori. That's true on the stomach. They produce called malt cell lymphoma.
Okay.
In the stomach.
Dr. Bal, this thyroid cancer, does it affect some other part of body also apart from thyroid? Does it go?
It can spread. It goes to the number one preference for younger age is to the lungs, and in older age go to the bone. It can spread to any part of the body from head to toe. I have got because I have got 11,000 plus thyroid cancer patient on my follow-up. So I see all sorts of, even going to testicle, going to kidney, going to adrenals, going to brain.
It can go anywhere.
It can go to the eyes, anywhere it can go.
Does it has the tendency of spreading faster?
But that cancer, that metastasis occurs only in fortunately in 10 to 11% patient in India. In US, only less than 2%. Because in US, they treat the most of the cancer when they are only 1 to 2 centimeter in size, and they are all low risk cancer. So if there is, all the cancer cells are taken out, So chance of metastasis is much less. But we see a lot big cancers all hanging here and there. They come with fracture. They come with unable to breathe. So they are already very advanced stage. So 10 to 11% of in Indian cancer, they at the time of presentation, they come with metastasis.
But that's a very interesting point, an important point, Dr. Bal, that you are saying that in US, the most of the cancers which are cured and they treat are the 1 to 2 centimeters. It's a very advanced, early stage of cancer. Yes. While in our case, in India, we have much more advanced cases coming to for treatment. What is the probable reason for that?
The reason is that the tumor, you see, to become one cell, to divide into two cells, that is called doubling time. The doubling time of the thyroid cancer cell is very long.
Low.
So very low. That means to 1 centimeter size nodule, if you want to see a 1 centimeter size nodule, you need 10 to the power 9. Means 1 billion cell make 1 centimeter nodule. And to make 1 billion cell, you need this 30 times the cell has to be multiplied, then it will be only 1 billion cells. If you go by 2 to the power 30, it will be 10 to the power 9, 1 billion cells. So as the cells, they are growing in size, some of them will try to invade the blood vessel surrounding, lymphatic vessel surrounding. But when they're small, they are more busy in their expanding. But when they grow, they want to more full. Like if I've got 5 brothers, one will say, okay, I am to go to US. Somebody will say, I am going to Canada. But if I've got only one child, your parents will tell, no, stay with us. We have this land. You are well off. You stay, job in Bangalore. Don't go to America, like that. You understand? As the tumor grow in size, so some of them look for avenues to enter in the blood vessel.
But I'm trying to understand, Dr. Bal, that how come people from they delay the treatment or presentation or reaching to the doctor, something which is in your throat, it's so vital. Why this delay? Is there no symptom, no sign, or what are the early sign people should look for?
I will show you how the people come to me and what stage. You can see this.
Oh my God, that's very.
No, this is after treatment. This is smaller. I will show you before treatment.
Yeah, so I can understand. So how much?
The people come like this.
So how come people let it happen?
Do you think his parents? Do you think his relatives, his son, his daughter, his family member not seeing this is growing something abnormal in the neck?
Yeah. So then why?
Because neglect.
So they don't consider that it can be cancer.
No, because there is no insurance. They have to pay from their pocket, and unfortunately, the thyroid cancer is 3 times more common in women than in men. And in India, and I will not be here. I will not be sounding like a chauvinist. I see in this country, the women patient are less treated. If the same husband will be disease, he will come running, but he will not look after his wife to come and show the disease.
That is I think common and happening for all kind of diseases.
All kind of
right? From food to something so essential like.
So that's why it is more. Thyroid cancer, unfortunately, is 3 times more common in women than in men. And then the whole family member will be seeing. They will go to the nearby homeopath, Ayurved, Unani, everybody. But this is a surgical disease. You have to take out the cancer. Unless you take it out, you will not get it.
What are the early signs? Like you are saying,
just a nodule. As I showed you, this is just a nodule.
This is quite advanced. This seems to be
No, I will show you a much earlier part also. You can see this. You can see this man has got a nodule and another 2 in the side by. Yes. He's not been bothered about that. Somebody told, why don't you go and see Dr. Bal? Then that's why he came to me. Okay. So this is the first sign is there is a nodule in the neck. This area, there will be a nodule. Thyroid gland, there will be a nodule there. That nodule, if you do a ultrasound, you can pick up as a tiny nodule as 5 millimeter. But if you palpate with your finger, you need at least 1 centimeter. And this type of nodule, they are all in inches. 10 inches, 5 inches, 6 inches.
So in the month of October, Dr. Bal, we were advocating that women should do their self breast exam. That is very
Yeah,
important to
yeah,
spot breast cancer on time or
yeah.
early stage. So are you suggesting that we should also kind of
No, no,
feel proud and
you see, breast is one vital organ which it is always hidden unless you are in film and other thing, that profession where there is showing off is different. But in neck, everybody has neck is exposed. There is nobody to hide the neck. So anybody, family member, your brother, your sister, your husband, your wife, anybody can see, hey, what is this nodule coming up here? What is
no, even before it comes up, maybe
yes.
just a thickness or
Yeah,
something.
that even if you 1 centimeter, up to 4 centimeter thyroid nodule, we are not bothered. Up to
Okay.
4 centimeter is curable,
Okay.
completely curable up to that is called stage 2, T2 tumor.
Okay.
T1 is 2 centimeter.
Okay.
T1 is the best tumor. You can, most of the time, T1 will have less than 1% chance that it can come back again. If it is 4 centimeter, there is 11% chance that it will come back again. But if it is more than 4 centimeter, chances of getting cure will be much lesser and lesser. If it is metastasis, only 50% we can get them survived, 50% will die.
I
Like
think the bottom line is that like any other cancer, you need to look for early spotting, early diagnosis of thyroid cancer.
yes,
Also,
before the cancer spread to other part, you
yes,
have to catch the cancer early. So take it out.
and
And
the
even if you have let something, give the radioactive iodine. It will go selectively to the thyroid gland. It will not damage any other part. They can produce any number of babies. They can marry. They can do everything. There is no. They're not like any normal life. They can have an absolutely normal life.
that's the best part, that even if you are diagnosed with thyroid cancer, 98% almost of these cancer are curable and
Yes.
very effectively curable, which will give you the complete lease of life.
Yes, and we don't have to worry. Many of my young patients, we have more than 1,000 patients who are less than 20 years old. Their parents will come with hush voice, will ask, is my child going to have normal life? Is he going to marry? Is he able to produce baby? Is he? I told they will be absolutely normal. You don't have to. They will outsmart you. Don't have to worry at all. And we have published papers showing that in our own series, the fertility is not affected. Particularly Indians are highly fertile. That you can know. Even if you put a couple of families in the Greenland, they will have, after 10 years you have to go and do family planning there also.
That's so that's it was wonderful talking to you, Dr. Bal, and you kind of described the whole this thyroid cancer like a like a real teacher and a professor, and actually gave us such a simple to understand examples. And the as I said, that the bottom line is very clear, that for like all other cancer, thyroid cancer, it may be less as of now, but as Dr. Bal says, that it globally it is fast becoming the number 2 cancer
Yes.
of the in the world, and it is equally possible that we in India may also get the similar kind of spread. So that is very important that we know it, we stay alert, and we also diagnose any kind of cancer, including thyroid cancer, on time. That helps treating it effectively and save lives. So here was Professor Dr. C.S. Bal sharing some very critical information on thyroid cancer, and how much, how we can prevent this, and how we can treat this disease. If you have more questions, you can send them to us through WhatsApp. To use it, you can click on the WhatsApp button on our page of ISW Council on Facebook. And also don't forget to follow us to stay updated on all that concerns your health and well-being. We will be back with our another special show on cancer prevention and care during COVID-19 next week, same time. So keep sending your questions and we will certainly include them in our next show. Until then, stay at home, eat healthy, sleep well, and keep giving your mind and soul the daily dose of positive thinking, because that's very important to keep you healthy and maintain your well-being. And don't forget to maintain personal hygiene and social distancing to protect yourself and your loved ones from the coronavirus pandemic. Goodbye and see you soon.